going to talk about parts of the brain and then specifically how they regulate mood. And the two parts that we're really going to talk about probably the most are the prefrontal cortex and the amygdala. Okay. And the prefrontal cortex, we'll just say simplistically, is like our higher executive thinking, our rational decision making, our calmer, motivated, rational part of the brain. Okay. And the amygdala is largely involved in flight or fight response. Okay. So that's our panicky, irrational, I don't want to say irrational, but can be irrational part of the brain that's associated with
more
fear.
Of an automatic response.
That's associated with fear and anxiety. And there's two things that have shown with PMDD. One's starting to be proven. One's a theoretical interaction. The first one is what are we actually seeing on brain scans? And when I say we, I mean the research community as a whole. Is we're seeing with patients that they may have a smaller than average prefrontal cortex or a less active prefrontal cortex and a overactive or slightly enlarged amygdala, right? So
hence the anxiety, depressive, rage responses.
Right. Because the amygdala is kind of running the show, right?
Mm-hmm.
The other thing, and this is coming out more theoretical in regards, is that patients with PMDD may, and we're seeing that this may be true in practice, may have a paradoxical response to a metabolite of progesterone that's called allopregnanolone, right?
Mm-hmm.
Paradoxical response meaning it does the opposite of what it's supposed to, right? Mm-hmm. So if progesterone normally improves GABA function and uptake, it has deleterious effects on GABA, right?
So this can happen to just more than PMDD patients as well. People can have negative responses to progesterone supplementation. It just seems to be more detrimental for the PMDD patients specifically.
Right. And we got to think about if they do have that response and you're blunting the effect or having a negative effect on GABA, and a patient whose fear center of their brain runs the show more anyway,
nothing is calming them.
Right. It's gonna throw them into a spiral. And then you couple that with transient fluctuations in serotonin and things like that because of estrogen ebb and flow. It's just a recipe for disaster.